really excited to be here today with Wendy Bailey, who has been with the Department of Mental Health for quite a while, but was recently appointed the Executive Director. And we have been really excited at the way you have reached out to us, and we've gotten to know you better, Wendy. So we wanted everyone else to have the same chance. So thank you for being here today.
Thank you, Joy.
You're very welcome. And just going to ask some questions and have a conversation. And if there's other things you want to share, of course, that's fine. But we wanted to start off just by giving you a chance to share whatever you want about yourself and your vision for the Department of Mental Health and that whole idea of a recovery-oriented system of care. And what does that mean from your perspective?
Okay. Well, first, thank you again for having me and giving me this opportunity. We've been discussing a lot recently about open communication and partnerships, and I appreciate you offering me the chance to do this and to be able to speak to people. I've been with the agency for 16 years, and I started my career at Mississippi State Hospital. And throughout that time, there have been a lot of changes, of course, within the agency, and I've had some areas that I have focused on, which I want to continue to focus on, and that's, improving communication and relationship building and expanding peer support and focusing on that recovery-oriented system of care, that you mentioned. There's been a lot of initiatives through the years that I think have really helped strengthen the system and help dispel the stigma associated with mental health and help expand that focus on the individual and that focus on a holistic approach. One of my drivers is understanding that there's always room for improvement. And you and I have had conversations about that in the past as well. Understanding there's always room for improvement, never settling for the status quo, I think can really help drive our agency over the next several years. And it's something that I strongly believe in. In this position, it's important to me because I want to see progress in our state, and I want to see change, and I want to see partnerships strengthened. And, growth and change, and this is something we've talked about, is something I embrace. It's not something that I'm fearful of. Change is what has made our agency grow so far. Our crisis stabilization units accept voluntary patients now, not just involuntary, and that's because of change. We have stronger supported employment programs and partnerships, and that's because of change. We have intensified services in the community like iCourt, and that's because of change and embracing that. And I think it's imperative that we continue that and that we, grow that at the same time that we create environments that promote acceptance and inclusion. And I think that's where a lot of our work with our peer support can come in as well. And looking at that recovery and sharing those stories of recovery, I think is just going to be, vital moving forward.
Okay. And that's one thing I was going to ask about is related to peer support. What are your thoughts about partnering with people receiving services and also with their families? And that includes peer support, but goes beyond that.
Joy, I have personal stories in my own family, both on the mental health side and on the substance use side. And I know going through those experiences with my family members, how much the viewpoint and the feedback from the family is absolutely vital. And I know that from my own personal experience, and then I know that just through my years working with the agency as well. Working with partners and working with families, in my personal opinion, has led to some of our greatest successes. And when I say our, I mean the state, that has led to some of the state's greatest successes over the years. One example, peer support, like we talked about. The development of the Think Recovery campaign, the development of the Peer Bridger initiative, the development of the Certified Peer Support Specialist program and the expansion of that into areas like parent caregiver. Those things have been done with feedback from families and with families being involved. And another area where that has been seen and where we need to strengthen is, for example, the Wraparound Initiative. That is something that Mississippi Families as Allies has as a priority, and I know we have as well. And there were the Division of Medicaid, University of Southern Mississippi School of Social Work. There's a variety of people at the table with that. And that initiative to try to provide those intensive services so that children can remain with their families and in their homes and thrive in their home and in their community. That's what, to me, that's what comes from those partnerships. That's the success that you see when you have that group at the table. I believe, and I've mentioned that it's very important to embrace new ideas and looking at innovative ways to improve services, looking at evidence-based practices and supports that have been successful in other states, and making sure that Mississippians have that opportunity for those as well. And looking at ways that we can find creative solutions together to help inspire hope and to help people and families attain their goals. But we can't do that in a bubble. That has to be done with feedback from the people who are a part of the system, from the people who are receiving the services and who need to be driving the system and driving the change.
I certainly agree with you, and our organization certainly agrees with you on that. And the whole definition of family-driven practice means that families are incorporated at the level of the system in decision making, not for their own children, not just for their own children, but for all children. And I know this is your interview, but I am going to throw in a little aside there. It's interesting you brought up wraparound, because there's so many possibilities with that. And there is, and you probably know this, there's this group that meets at the state level to look at some of the challenges with wraparound. And I think there's a real opportunity right now for the state agencies to look at policy with that, because one thing we've been looking at is, with high fidelity wraparound, there's some things that should be set in place from the beginning. And I think because our state began wraparound earlier than some states, some of those things didn't get set up, like, for example, a firewall between the services and the payment, and that has ended up creating some issues that we all need to look at. But I do think there's some real opportunities for things like that. And then to have families who are receiving wraparound through MyPAC or through a system of care project at the table to say, this is what happens on the ground for us, because maybe some of these policies aren't as set as they could be. So I think that's one area where there's tremendous amount of potential to work together. And something you and I have been working on is in the Interagency Coordinating Council for Children and Youth, which is in statute and is supposed to be meeting twice a year, which is all the state agencies and different groups, and we're on there, families, to make sure that our system of care for children is coordinated and operating the way it should be, that that's community-based, strengths-based, and family-driven and youth-guided. That hasn't been happening, but we were very excited that that was one of the first initiatives proposed that we work on together, getting that going again. So I want to publicly thank you, but also get your thoughts on what you most hope comes from that.
You're right. That's something, Joy, I'm very excited about. And something that, you mentioned with wraparound, that our state was kind of early in the development of that. Peer support similar as well. There's some things with Mississippi that, we may piggyback on some other states, and a lot of times we may not be first at the table, let's say it that way, in the development of something. And then there's others where we are ahead of the game or ahead of a lot of states. And I think what you just brought up, reevaluating it and looking at, okay, that's where we were and here's where we are now and what improvements need to be made is absolutely important. And that's kind of where ICKY is as well. You know, when that legislation was passed in 2001 and putting that emphasis on that system of care, which is, it's called a system of care. And I know you know this, but it's more of a philosophy.
Mm-hmm.
And our state putting that emphasis on that was fantastic. But, you know, through the years, it just we haven't been regularly meeting. And moving into this role, it was something that I did want to make a priority to bring us back to the table and to work with you on that as well. You know, we have federal grants from SAMHSA, and that is something that they want as well. I mean, nationally wants to see that for the state. And, you know, you've mentioned before that that piece of legislation really was a national model.
Mm-hmm.
So some of the things that I would like to see come from that, we have gaps in the system that need to be addressed. And we need to truly understand and know where those gaps are, because we can address those. And I think we can address those by coming together and working together with other state agencies, with advocacy groups, with other partners, private and public, and coming together and looking at this system as a whole and looking at this approach of a system of care. And what do our children need to succeed? And what do our families need to succeed? It is absolutely a ripple effect, and you have to look at it from a holistic viewpoint. I think us looking at what services are needed for transition age, that is something that I feel like needs to be a priority. Housing, education, independent living skills, employment preparation. I mean, that transition age youth is vital, not just for the success of that youth and that family, but for our state. Also focusing on services for youth who may be co-occurring. You may have serious emotional disturbance. You may also have an intellectual or developmental disability there. You might also have a substance use disorder, autism. I mean, looking at it's not necessarily a round hole and a round peg. Looking at it from a more broad viewpoint. And then working together with Child Protective Services is something that I really want to see our agency strengthen as well. We have to look at placement options for youth who have exhausted all other options. And again, these are things that can't be accomplished without interagency collaboration and everyone being at the table, which is the purpose of ICKY. And I also think looking at an expansion of the first episode psychosis program is going to be important as well. You know, Navigate is something that the state has now. It's an evidence-based program, and it's for Mississippians ages 15 to 30 who have experienced that first episode of psychosis. And there's some awesome coordinated specialty care teams that work together with that. And we've seen it grow over the last few years. But to me, that's a very key early intervention and recovery-oriented service that can go far or go farther.
And I agree with you. There's a lot of very good things that could come from the ICKY beginning to meet again. And I guess when I think about it, I also think about from the standpoint, because you mentioned a lot of specific services or approaches that could be enhanced. I also think it will be a real opportunity to step back and say, you know, we don't really have an integrated system of care in Mississippi where a child can enter at any point, and families shouldn't have to know, you know, to go through this door or that door. It should just be that we're integrated enough at the state level and then at the local level that the services can be and supports can be brought to them. And we're not there yet. And then to have those kinds of things grow out of that. And that's one thing I'm really excited about. And this is a question that's related to that, but would affect more than children. It would also affect adults receiving services, is that whole idea. In our state, as far as I know, there's not really anything other than good faith, which we've got a lot of, and a lot of people who are very committed to doing the right thing, as far as how the infrastructure to coordinate Medicaid, the Department of Mental Health, and then the community mental health centers and the other groups that are certified as those. Do you have, and that's kind of jumping to another area, but do you have any thoughts about that in your role? Or are there any things going on that are helping that kind of coordination and collaboration occur more?
So that is something, as well, Joy, I absolutely agree with you on. There's a few things that I've already kind of started to do as far as with me and my role in the last, I guess maybe 60 days. But there's a few things that I've started that I want to continue, and then I want to get more feedback on where we need to go from there. I think I've had some very good meetings with the executive director of the Division of Medicaid, and I want that to continue. I think building that relationship and looking at ways that we can improve data sharing and that we can work together to make sure that people are getting the services that they need is going to be key. With the community mental health centers as well, one of my first priorities was to meet one-on-one with each one of the community mental health centers, just to sit down and talk about, what are the challenges that you're experiencing and what are the opportunities that lie ahead, and kind of start laying some groundwork for that as well moving forward. I think that open communication is number one, and then making links and connecting with other people, being able to bring community mental health centers more at the table with planning and some initiatives that we will have going, looking at fidelity reviews and fidelity monitoring and technical assistance that can be provided. What can we do as the state agency to strengthen that? The Community Mental Health Center has their association now, which is wonderful because they are communicating and meeting regularly, and I know that strengthens them as a group as well, which in turn can strengthen the services and the supports. So I'm excited to see just that whole communication piece and that data sharing piece, and that looking at outcomes and looking at improvements with outcomes as we move forward as a group.
Well, that's good to hear. And I will say you have been very open to listening. And I'm sure there's people watching this who are a little surprised to see both of us on the same screen. And I'm glad they are seeing us on the same screen. And I've really appreciated the conversations we've had. And, you and I have had conversations about some of the things we've looked at about, is our system even structured the right way so that all those entities can communicate? And I don't know, but I think it's something that needs to be looked at. And I appreciate how open you've been to that conversation. And some of the other things we've talked about, I wanted to bring up. One is, and we don't really have any secrets around here. I think this has come up publicly before, and you and I talked about that. On the executive management team of the Department of Mental Health for quite a while, there hasn't been anybody who was a current licensed mental health provider. And I shared with you that seemed concerning because, is there the level of clinical expertise there that's really needed? Now I understand that may be changing. And I just wanted to I first wanted to say that it is, that is something we have brought up as a concern. I think it's changing, and I wanted to give you a chance to let us know the latest on that.
Okay. I am very excited, and this will really be the first time it's announced just outside of the board meeting. But
this is kind of like when people make a big announcement, like a movie star says, "I'm pregnant" on, I don't know, the Tonight Show or whatever.
That's right. Breaking news, Joy. We've got, I'm very excited about two roles, two people who are going to be joining us at central office. And they're both starting on April 1st. And one is Dr. Mallory Malkin. And she is she's a clinical psychologist. And she will be serving in the role as the director of the Bureau of Community Mental Health Services. But because she is, of course, an experienced clinical psychologist, her title is going to be Chief Clinical Officer for Community Mental Health Services. I'm so excited about this because she brings unique experience from both the state-operated program side, the community private provider side. She brings experience from children and youth services and adult services. And with her in that role, I really want her to work to develop with the team and implement and expand a consistent continuum of care, a very comprehensive continuum of care of services for both adults and children in our state to better help people be able to live in their home and live in their community. She's also very outcome, evidence-based, practice-driven, which we need. And we need a focus on that and outcome reporting. And I think she's going to bring a very much needed approach to working with partners and bringing everyone to the table. So I'm thrilled to have her in that role on the mental health side for community-based services. On the IDD side for community-based services, we also have Dr. Kristen Merritt joining us April 1st. And she is a clinical psychologist as well, who's worked at Mississippi State Hospital. She has 21 years experience in the IDD field and specifically looking at the waiver and the community support program. And again, what is that continuum of care that we need for people to be able to be served in their home and in their community and not, in an institution, but to be able to have those services wrapped around them that they need. And I'm very excited for Dr. Merritt and Dr. Malkin to be joining us on the same day, April 1st. So I'm thrilled about that and adding them to the leadership team. I think we have a very, very strong leadership team moving forward that truly understands a recovery-oriented system of care and understands where we need to go, not over the next 1 year. Joy, I want to look out of where we need to be in 10 years, where we are now and the growth that's happened and how we can enhance that and where we want our state to be in 10 years. And I think that they're going to bring a lot of expertise to the table.
They sound like two great additions. And I will say, I know Dr. Malkin quite well, and she actually did some training here. So not just because of that, but I think she will bring a lot to the table. And she obviously has a openness to working with organizations that are consumer and family driven. So I'm actually excited about that.
Me too.
And then another thing you and I have talked about is the lawsuit to some degree, and that Mississippi has been in this situation since about 2011 with the Department of Justice, where there were findings about the state's mental health system. It was sued in 2016. That case went to court, I think, in 2019, and the judge found in favor of the United States. So the state of Mississippi, and I do want to make clear it's not just the Department of Mental Health, but that you all are a primary entity involved, and the Department of Justice have been working on a proposed remedy. So what would the state do to address the problems that were found in the lawsuit? Now, in the last status conference, which I really appreciate the judge having those so that the public can listen in, and I'm not a lawyer, but one thing that came up is it sounded like the state and pretty much an agreement of what should happen next. But there was not agreement on, once these changes started getting implemented, how they would be monitored. And I couldn't tell if they were saying that the state would monitor itself or if that would be up to the judge or the Department of Justice. I don't know. Can you comment on any of that?
Honestly, not very much.
Okay.
The Office of the Attorney General is the lead in this. and they are the ones that are handling all aspects of what came from the judge's order as far as a proposal being submitted by the end of April, and where we are on working with the special master and the remedial plan. That's all flowing through the Attorney General's office. So I can't necessarily comment on any specifics about that. I can tell you that I do feel like the work with the special master has been beneficial, and the work that's been done over the last few years, especially the last couple of years when we've been able to shift funds from the institutions to the community to enhance what the legislature has already provided. You know, a lot of these new services that have come out in the last several years has been a result of the legislature knowing about this and hearing about this and seeing that need for adult mental health services in the community. And, you know, we've seen a decrease in the institutional side spending of about $70 million and an increase of about $88 million in the community side. And that's something that we want to see continue to where that funding can be devoted to services to help keep people out of the institutions. Again, we want that continuum of care, but we want to make sure that those services that are at the core of what you've referenced are there and in the community and are being efficiently and effectively provided to the citizens of our state. So I think we'll see some more growth in that as we move forward, you know, as well.
Okay. And I've been curious, and I don't know if you could comment on this either, just there have been those shifts in funding. I didn't realize it was as much as what you said, but I'm not doubting you. I'm just thinking back to like looking at the different budgets and stuff. So that's great. And I do know also there's fewer employees in the institutions than there were, and fewer people, patients in the institutions. So one thing I've wondered about is, I think the state has, even though like on an organizational chart, some of them have been put up under other ones, but there's actually like 6 facilities on the mental health side, 6 facilities on the side for people with developmental disabilities. Has there been any thought, since the employees are decreasing, the funds are decreasing, the people using those services are decreasing, to closing or consolidating any of those? Because it seems like just keeping them open, particularly with staff spread really thin, would cost money and might not be as effective as putting some together. Have there been any thoughts in that direction?
Well, I think the administrative consolidation that was done a few years ago, Joy, was kind of the first step of looking at that, where exactly like you said, there were kind of umbrella agencies. For example, East Mississippi State Hospital, North Mississippi State Hospital, South Mississippi State Hospital, and CMRC were brought under kind of the umbrella of East Mississippi State Hospital. And what that allowed was for, because we haven't filled as many pens. When I started with the agency, I think we had almost 9,000 employees, and we have 5,500 now filled pens. So what it allowed was for them to share resources, to really start being able to look at that, share human resources staff, share some administrative support staff, and that's been beneficial. That is actually what allowed for a lot of the funding transfer to go to the community side, was through that administrative consolidation over the course of about 2 years. So that's something moving forward. We want to do everything in a safe manner, and we want to do things in a timely manner as well. When we have seen, and you're right, we have seen a decrease in the number served for acute psych, and with that has been the closure of beds. I think it's also though important to keep services in a variety of places in the state as well. So like North Mississippi State Hospital is in Tupelo, and it can serve that north area of the state, and it's 50 beds. South Mississippi State Hospital is in Purvis. It's 50 beds and can kind of serve that south part of the state. So, I mean, I think that's an important component and aspect to look at, as well. But we have seen that decrease in the number served, and we are seeing that decrease in the pins. And I think that's something for future planning purposes as well.
Well, that's good. And, it's so hard to know what the right answers are, if and certainly there's not one right answer, and people need the continuum of services. I think there's also that question of, if somebody needs intensive acute care, does it have to be through a state facility? So I think that's something else to look at. And one thing that we had put out and that we needed to correct is, just the number of employees that the Department of Mental Health has. And this is the employees in central office and then in the facilities that you brought up. It's 5,500, I think, around. And sometimes people think that includes the community mental health centers too, but it doesn't. So, and we've had concerns about that, and it's hard to find exact comparisons. And we put out one comparison between Mississippi and Georgia, where we used the wrong figures from Mississippi, and it was the pins you're allowed as opposed to the ones that are filled. So, but even with the 5,500, I still think, we need to continue looking at what needs to happen, because the numbers we got from Georgia were using the same basis of comparison. They have 5,000 employees in their state mental health system, and their population is like over 3 times as large as Mississippi's. So there's probably still some things to look at in that regard, and we would certainly, however we could support the department in looking at those kinds of things, and the ways to make transition to more community-based services in a safe way, we would want to support, but it still seems to be an issue to look at.
I agree, and I think it's really important when we look at those things to truly compare, apples to apples or oranges to oranges, as far as ICF level of care with the department operating the IDD programs as well, and we've seen a decrease in that census too, and we want to see that continue. But looking at there's requirements for staffing and 24-hour, 7-day-a-week care. And so you have to take all of that into consideration, as well, for the safety of the clients and the patients being served too. And just the whole kind of structure of a system with mental health, IDD, and A&D all under one. But and agencies and states vary. So I think, moving forward, that is something that we have to look at, and look at how is it done in other states, but also how does the system compare? Right.
And and that would probably be a whole nother interview. But one reason we picked Georgia is it appeared to be very similar, and they're also dealing with a similar lawsuit. So they know some of the challenges, and their structure of how they have their Department of Mental Health set up seems somewhat similar to Mississippi. So anyway, it's just something to keep looking at. But I also wanted to ask you, because I've asked you a lot of questions about the Department of Mental Health and are there things as far as your relationship with families as allies, ways we can support you, things you want to know about us, feedback you have for us about how we could be more effective or helpful? I just wanted to open that up to you.
I think as an advocacy agency, and the work that you do with families, and the work that you do, Joy, I know y'all have partnerships with education, and it goes way beyond, just the Department of Mental Health. It's other state agencies and families across the state that y'all are involved with. I think information sharing is very important. One of the things that we've done is there are these new services that are being added. There are intensive community support services that this fiscal year that we're currently in have been added to, where by the end of the fiscal year, so that would be June 30th, there'll be some level of an intensive community support service available in every county in the state. But you've got to get that word out. So I think one way is us partnering together to be able to share messages and to be able to share information of what is available. y'all did a great job of helping us get our message out with the website. And you've done a feedback survey for ICKY to bring in more feedback and to see what we need to focus on. I think pulling in that feedback and then sharing that with us and being able to help us push out messages too of what's out there, where it is, how to access it, can really be helpful. I'm excited about our partnership to try to reestablish ICKY. I'm excited about Mississippi Family's role in the parent caregiver certified peer support specialist credential and that training that y'all provide, that customized training, seeing that continue and looking at ways that we can enhance that and have more people come through the training. Looking at different ways. I know that I'm very excited about the virtual support groups that y'all offer and looking at that continued support that you provide to children and families. And I know the work that y'all do with the Wraparound Institute and the work that y'all have done with the Hinds County MAP team is fantastic, and the state level case review team and your involvement on that as well. That collaboration and that partnership that you work with us on is particularly UMMC for CHAMP and looking at how to ensure that there's expanded access across the state, particularly in those rural areas of the state that we know struggle with that. I think a lot of us just being able to look at, we have the same vision, and that is we want to have a state that provides access and care to families and to children who the overall is an improved outcome for the future of that child, for the future of that family, and for the future of our state. And I think we share that same vision. And I think that can be what drives us moving forward and working together. So I'm excited about a lot of the partnerships and so much of the work that Families as Allies is doing and where that can go in the future.
That is very kind of you. And you can always be very candid, and so can anyone listening to us, with your feedback for us or about me and how we can do, like how we can be more responsive, how I could be more responsive to working together. And our mission is to make sure families are partners in their children's care. And what we mean by that is that the Mississippi system of care for children will be family driven. So there's lots of opportunities there. And we did, as you mentioned, and I can't remember if I said it, but you definitely mentioned it. We do have a survey for everyone out there, families, people working in other systems. What do you all think the Interagency Coordinating Council for Children and Youth should work on? And you can go to that survey. And so as this council gets reestablished, that feedback can guide the council from the very beginning. And I think both you and I agree that all the meetings will be open, that there will be an opportunity for public comment, so that it will be a partnership from the very beginning.
Right.
Yeah, so I think there's going to be tremendous opportunities there. Well, Wendy, I want to thank you very much, both for taking the time to do this, because I know how busy you are, and just for your openness and kindness and willingness to partner. Was there anything you were hoping to get to say that you didn't get to say?
No, I don't think so. I'll just say this, Joy, I'm looking forward to a bright future. I have a child. He's 9 years old. He's my heart, and I want him to have what he needs to be productive and healthy and safe and happy. And that's what I want for all Mississippi children. And I think we can make that happen.
We do too, and we're really looking forward to working on that together. So thank you very much, Wendy. Oh, and I will you gave a shout out to the director of the Division of Medicaid, who's Drew Snyder. I will give him a big shout out too, because Drew made the mistake at one point of giving me his cell phone number. So I actually helped Drew with lots of ideas about how he could run the division through my text. Yeah, so you might want to take that as a warning. But he has been very open to feedback and ideas about ways to work together. So there's probably lots of ways that we can all work together. And I would say the same thing about Dr. Dobbs and Dr. Wright. So, and I'm probably leaving someone out, but I appreciate you giving him a shout out, and I wanted to too. Well, thank you very much, Wendy, and maybe we'll do an update about the ICKY soon.
I hope
thanks.
so.
No, thank you so much.
Thank you, Joy.
All right, bye.
Bye.